Let us now go to visual diagnosis of the skin. The topic is erosion of the skin and rashes. Skin erosion is a superficial break in the epidermis that does not extend into the dermis and that heals without scarring. Erosion is often seen after the appearance of vesicles or pustules. Red erosion with oozing of a yellow fluid indicates damp heat. Erosion with an exudate of thick yellow fluid indicates damp heat with toxic heat. Erosion with oozing of thin watery fluids indicates dampness with underlying spleen deficiency. A rash called zhen in Chinese is a redness of the skin caused by vasodilatation. The Western medical name is erythema. The main rashes to be differentiated are measles, German measles, chickenpox, and urticaria. Measles, called hemp rash in Chinese, was once a common childhood infection. It is now rare in developed countries, but in developing countries it is still common and still a major cause of child mortality. German measles, called wind rash in Chinese, is a common childhood infection with a benign course. Chickenpox, called waterpox in Chinese, is a common childhood infection characterized by dampness. Here we can see the differentiation of measles, German measles, and chickenpox. The general symptoms of measles are high fever, cough, and listlessness, while German measles will have a low fever, but the child will not feel so ill, but there will be swelling of the glands behind the ears. And for chickenpox, there will be low fever, but the child will not feel so ill. The onset of rash for measles is it appears gradually about 3 days after onset. For German measles, it appears rather suddenly and completes in 24 hours. For chickenpox, it appears after 1 to 2 days. The color of the rash for measles will be dark red, while German measles will be pale red, and chickenpox will be white with red around the edges. The shape of the papules for measles will be protruding, large or small, but first loosely distributed, then it becomes dense. For German measles, it will be small, round, and loosely and evenly distributed, causing itching. For chickenpox, it will be round, ranging in size from rice grains to beans, and will be filled with fluid. The distribution of rash for measles will be first behind the ears and neck, then the face, trunk, limbs, hands, and feet, and it will be densely distributed. For German measles, it will first be on the face, then the trunk, the limbs, but not on the hands and feet, and they can resolve pretty quickly. For chickenpox, it will be on the face, trunk, limbs, and very few on the hands and feet. Measles will leave marks while German measles do not, and chickenpox will leave concavities. Thank you so much for your attention.